Now, a new study commissioned by the World Health Organization into long COVID estimates 17 million people in Europe are living with the symptoms of long COVID.
In March 2020, when coronavirus was beginning to spread around the globe, various measures to stem the virus were imposed in many countries. But as parts of Europe began easing lockdown measures in the summer of 2020, doctors became aware of patients who were not recovering fully from COVID-19, and some were suffering long-term symptoms. Doctors came to describe these symptoms as long COVID. They include fatigue, body pain, mood swings, cognitive problems, and shortness of breath. Now, the World Health Organization's report says as many as 17 million people could have been suffering with long COVID between 2020 and 2021. Modeling carried out by the researchers also suggests that women are twice as likely as men to experience long COVID. Alexandra Martin-Krinig lives and works in the Austrian city of Vienna. She has been suffering from symptoms of long COVID since August 2020.
Things kept getting worse. The scariest thing was that nobody knew what was happening. I was off work for 9 months in the beginning, then I started a phased return, I had to interrupt it, was off work again. Back then I was running a department, and I realized after 1.5 years of long COVID that this is something I cannot do anymore.
Molly Williams, a British physiotherapist working at a hospital in the north of England, was diagnosed with long COVID earlier in 2020. She says the onset of symptoms were completely unexpected.
Having done a 5K run 2 days prior, I woke up one morning with a horrendous temperature, a headache, extreme fatigue, and I got to the stage where I couldn't leave the house. I lost all confidence in my body, and it didn't just push back on my physical health, it pushed back to a degree where I lost myself.
In her work as a physiotherapist, Williams has come across other patients who've been diagnosed with long COVID. But she believes the problem may be much bigger than health workers first suspected. According to the WHO, Williams' suspicions are correctly placed. Doctors say long COVID, which they first found so difficult to diagnose, must be recognized as a disease for patients to be able to get access to the medical attention they need.
It's really important right now that we accelerate the amount of research, the amount of reporting of cases, that we really assess the burden of disease in countries, and that we understand really how treatment can provide support to patients and we can help them in their path to rehabilitation and well-being.
The WHO is calling for governments and health authorities to focus on long COVID and people living with it by sharing data. Worldwide, the WHO report commissioned from the Institute for Health Metrics and Evaluation shows nearly 145 million people globally have suffered from symptoms of long COVID during 2020 and 2021. Bureau Report WION, World is One.